We know a lot of industries are dealing with worker shortages, and the medical industry is no exception. We've heard a lot lately about the need for more nurses, but there is also a shortage of anesthesiologists. I spoke with a professor of anesthesiology at UNC about this. Anesthesia, it's a necessity in the operating room. But UNC professor of anesthesiology, Dr. Bryant Murphy, says there's a nationwide shortage of anesthesiologists and other medical professionals trained to provide anesthesia.
On a daily basis, we probably are 5 to 7 people short just in one particular category.
He says there are a number of reasons for the shortage, including the pandemic and a general shortage of healthcare workers.
And a lot of it has to do with just expansion. Hospitals are expanding. The sites that we go to provide anesthesia are different than we used to.
In addition to hospitals, anesthesia providers are needed in places like outpatient surgery centers.
A good example might be your GI clinic where you go to get your colonoscopy. So we're doing anesthesia in ways there now that are different than there were 10 years ago.
Dr. Murphy says UNC has not needed to reschedule surgeries due to the shortage, but the hospital must constantly figure out ways to work around it.
Really just talk about how can we shift things around, maybe reallocate to make sure that the resources are in the place that we need them to be at the time that we need them.
And Dr. Murphy says UNC is focusing on recruiting and retention, but there's a lot of competition across the state and across the country for a limited number of people who do this job.